The Home Health Aide Textbook, Home Care Principles, written by John-Nwankwo, RN, MSN. Narrated by Dan Absalonson. Introduction. This book was written out of an inner passion to provide a quality but concise textbook for home health aides as well as caregivers. If the reader gains any new knowledge from this book or finds new strength to care for people who require care in their homes, then the purpose of this book would have been achieved. John-Nwankwo, RN, MSN. Chapter 1. Introduction to the Home Health Agency Role. Outline. 1. Introduction. 2. State and federal regulations and requirements for HHA certification. 3. Purpose and goals of home health care. 4. Members of the home health care team. 5. Roles and responsibilities of the certified home health aide. 6. Common observations and documentation to be done by the HHA. 7. Key steps in the communication process and methods of communication. 8. Key steps in accommodating communication with clients with hearing or speech disorders. 9. Effective techniques for communication with home health team members. 10. Effective communication in learning about clients. 11. Access to community agencies to meet client needs. 12. Organizational and time management techniques for a daily work schedule. 13. Conclusion. 1. State and federal regulations and the requirements for HHA certification. According to Davila, ND, to become a home health aide, there is no standardized national educational requirement. It depends on which state the HHA is in. While in some states, they don't need any state-approved training, other states need them to take state-approved classes, pass a competency test, and earn a state certification. These classes are usually offered in the community colleges or vocational/technical schools. Most skill training for HHAs are taught by other healthcare professionals, like nurses, and is usually administered during the training period. Usually, their training is molded around the unique needs of home care clients. They also receive orientation on the job. Depending on the level of care needed by the client, the HHA's training could be done from a few hours to a few days. For more complex cases, some employers provide training classes which the aspiring HHA has to pass before they are given a job. Most employers would rather hire a certified home health aide than an uncertified caregiver. The HHA certification process includes at least 75 hours of training and as much as a 120-hour course in a state like California. It involves the theory section of the training and the skills section. Other requirements may include a background check of candidates before enrolling them to a program, due to the high-trust nature of the job. Sometimes, physical examinations and health screenings, like a tuberculosis test, may be required to prevent patients from contracting diseases from their caregivers. 2. Purpose and goals of home health care. Home health care involves a range of care for a wide variety of patients outside the hospital setting. The services that home health care companies provide can range from nursing care, physical therapy, occupational therapy, speech therapy, etc., from qualified medical professionals to smaller services from home health aides. The care provided could be as simple as assistance in everyday activities, such as bathing and eating, to more complex services requiring more specialized professionals. Essentially, the purpose and goal of home care is to provide an adequate level of care in a cost-effective manner while promoting rehabilitation of the patient in a familiar environment like their homes. 3. Members of the home healthcare team. Physician. Physicians perform home visits to the patient at regular intervals where they assess the patient in an environment that the patient is more comfortable in. They assess how the patient handles his illness at home. The physician regularly checks and makes adjustments and interventions when necessary. There are 2 ways in which a physician can function in the home healthcare setting. One of them relies on the home healthcare nurse as the leader, mediator, and coordinator of the group, leaving the physician to be an evaluator of the patient's health to be coordinated with the rest of the team by the nurse. The other way that the physician can function is to be one who will lead the team by taking a more active role in patient care. The physician writes prescriptions for the home care client. At the patient's home, the nurse will be able to get a more in-depth assessment of aspects of the patient's life that is not normally accessible from the hospital setting. In the home, the nurse can look for environmental factors found in the home that could affect the patient's illness. They could see how the patient acts in a more comfortable setting than a hospital. They can assess the patient's compliance with a therapeutic regimen, including diet, exercise, and medications. From these observations, the registered nurse can identify some areas that need adjustment in the patient's activities and make interventions to change them for the patient's health. They can also assess the tasks of the healthcare team and change them to better suit the therapeutic regimen, especially if the registered nurse is the one functioning as the team leader and coordinator. Nurse. Most of the care in home health care is rendered by the nurse. The nurse collaborates with the physician to give the patient the proper care that he needs. They also work with the rest of the personnel in the home healthcare team to coordinate the services being provided to make sure the patient gets optimal service from each of them to improve the patient's quality of life at home. They perform different nursing interventions adjusted in frequency to suit the patient's needs. During the initial assessment, they also decide which of the other ancillary services are needed by the patient, and this is relayed to the physician, who makes the final decision. The nurse's recommendations influence the interventions ordered by the physician. The treatment plans change based on the changes noted by the nurse, since they spend the most time with the patient. Because of this, they are the ones in the position to make the comprehensive problems lists and the assessment of care and goal plans. When there are multiple therapies to be done by different members of the home healthcare team, the nurse schedules the interventions in a way in which they do not overlap, so as not to inconvenience the team or stress the patient. Perhaps one of the most important responsibilities of the nurse is the documentation. They compile all the data about the patient, including the treatment plans, prescriptions, and assessments. This serves as a valuable resource to be used by the whole healthcare team, and serves as proof that the team is doing their job. Nurses are also the ones who stay in contact with the whole team, and other community services that could be involved in the patient's care. The nurse updates the rest of the team and allows sharing of information through case conferences. Pharmacist. The role of the pharmacist in the home healthcare setting is to be responsible for the patient's or caregiver's willingness and ability to be trained to properly administer medications, including the appropriate indications, dose, route, method of administration, and appropriate laboratory tests to monitor the patient's response to the pharmacologic therapy. They use their clinical judgment as to whether the first dose of any drug could be given at the home. It is their job to teach the caregiver about the medications, their effects, adverse effects, any drug interactions, storage and preparation, disposal, special precautions, and general management of drug effects, including emergency procedures. They also make sure that the patient does not run out of medication by checking their stock and by directing them to where they could get medical supplies. The pharmacist works together with the other healthcare professionals, the patient, and the caregiver in the making of the appropriate pharmaceutical treatment plan for the patient. They must always be available in case there are any problems, questions, or concerns regarding the pharmacologic treatments. It is important for home health aides to check their state regulations before assisting with medications because most states do not allow HHAs to administer medications. Physical therapist. The physical therapist is needed when the patient has trouble ambulating or has a disability that prevents him from performing everyday tasks. It is their job to assess the patient's disability to determine if the patient needs assistive devices. Once a patient is eligible for an assistive device, the physical therapist has to be the one to teach the patient its proper use. He also helps the patient increase his mobility and reduce risks of injuries from accidents. He creates the home exercise program to help the patient move around more. During every visit, he assesses the patient's mobility and adjusts the exercises as appropriate to the patient's range of motion, muscle strength, and endurance. Occupational therapist. The occupational therapist is concerned with how the patient's disease or disability affects their ability to function normally. It is their job to help patients achieve a higher level of independence in everyday tasks, such as bathing, dressing, elimination, cooking, eating, and housework. They provide the patient with information about various techniques, equipment, and aids that would allow them to function through their disability. They can help the patient make adjustments to their homes and belongings to improve the patient's functionality. They can teach energy conservation techniques for patients who have low endurance. They are also the ones to teach patients to use specially designed devices to increase their autonomy and functionality. By allowing the patient to do more by himself or herself, their self-esteem increases and can decrease the need for constant supervision. These therapists manipulate the environment of the patient to make it easier for the patient to function, such as widening doors for wheelchairs, grab rails, guide rails, placing objects and switches within arm's reach of the patient, adjusting furniture for easier travel around the house, etc. Speech therapist. The speech therapist helps patients recover and develop their communication skills for those who have lost the ability to speak normally. They teach compensatory communication mechanisms that use visual cues and cognitive retaining. They use a wide range of communication aids and technology, such as hearing aids or an electrolarynx. They also teach sign language and the use of communication boards. As technology for the speech-impaired increases, some speech therapists can even teach patients in the usage of transcription technology, which transcribes spoken words onto a computer screen. Social worker. The social worker provides emotional and psychological support to the home care team. The social worker is the one with access to community care services when there are conflicts with the treatment plan or if the patient refuses care. When more support is needed in the care of the patient, the social worker assesses the patient with regards to mobility, personal care ability, including an assessment of finances if the patient could afford another professional on the team. They also include the assessments of the rest of the home care team in the making of this decision. The social worker is the link to formal and informal sources of support, whether it comes from social groups, organizations, or help groups. The social worker coordinates, teaches, counsels, assesses, facilitates ethical decision-making issues. They also maintain standards by regular visits and inspections. They are available through a 24-hour emergency call system for the elderly and disabled. Home Health Aide. The home health aide fulfills the personal care role for the patient. They do the daily tasks of bathing, clothing, positioning, and environmental care of the patient under the supervision of the home care nurse. Karashi, 2006. 6. Key steps in the communication process and methods of communication. The key steps in the communication process are creation, transmission, reception, translation, and response. Methods of communication, especially in the home healthcare setting, consist of verbal and nonverbal modes of communication, such as written communication. Schreiner, N.D. Since the HHA has the most contact with the home care client, it is imperative that he reports any changes in the patient condition that is noticed. He should ensure that the data is being transmitted to the right personnel to avoid a breach of patient confidentiality. Clarity in communication is also very essential. Avoiding the use of unnecessary abbreviations, e.g., the PT visited the PT. This could mean that the physical therapist visited the patient. It could also mean that the patient went to the physical therapist office. In any case, there could arise some confusion as to the actual meaning of the documentation. Write in clear, simple language that everyone can understand. Avoid cancellations, and if there be a need for cancellations, use only one line across your documentation. 7. Key steps in accommodating communication with clients with hearing or speech disorders. It is prudent to keep in mind that this type of communication is difficult, so patience is needed. The nurse must speak in short, clear sentences. Do not use a lot of jargon. Use communication tools such as pen and paper, pictures, or sign language if the patient has been taught. If the patient cannot speak, ask yes or no questions instead. Use communication aids. Consult a speech therapist. Communicating with patients who have speech/language difficulties, 2009. The HHA must speak in a clear manner, loud enough for the patient to hear, but at the same time not shouting. If the client hears better with one ear, stand closer to the ear with a better function. Facing the client with hearing difficulty is often helpful since most of them compensate with lip reading. Never be in a hurry when communicating with clients with hearing or speech disorder. Allow them time to finish their sentences, and do not assume that you know what they have in mind to say. Encouraging sign language when the client is being trained to recover their speech abilities is not a good rehabilitation technique. 8. Effective techniques for communication with home health team members. One of the most effective techniques for communication, and the most important, is the written form of communication of the documentation. This record of everything done by, to, and about the patient is meant to be a non-urgent form of communication between the health team members. It should be regularly updated so that the other team members will be abreast of the patient's current status, view old and current interventions, etc., so that they may be guided accordingly in the care of the patient. Green, 1996. Another effective technique in communication with the health team is the case conference. This is a regular meeting of all the members of the team, wherein they exchange information and plan for the care of the patient. The verbal and written exchange of this conference results in a treatment plan that covers multiple aspects of the patient's care, making sure that the patient is cared for holistically. Karashi, 2006. 9. Effective communication in learning about client. Effective communication can go a long way to help learn things about the client. It is important to form a good nurse-patient relationship. To effectively communicate with the client to gain her trust as well as gain information about him/her, the nurse must be prepared with information for the client's questions, maintain eye contact, observe body language, listen closely, pay attention to both verbal and nonverbal cues, avoid medical jargon, phrasing questions in ways the patient will understand, and most of all, be sensitive to the client and choose the right moment to ask questions. Communication Skills, 2007. 10. Access to community agencies to meet client needs. As stated above, the home care nurse and the social worker both have access to other community agencies and resources. Through the National Association for Home Care and Hospice, here are some of the affiliates and community agencies that could cater to the needs of the client. Hospice Association of America, Private Duty Home Care Association of America, Center for Healthcare Law, World Home Care and Hospice Organization, Pediatric Home Care Association of America, Hospital Home Care Association of America, Proprietary Home Care Association of America, Voluntary Home Care Association of America, Home Medical Equipment Association of America, Psychiatric Care Services, among others. Karashi, 2006. NAHC Affiliates, ND. 11. Organizational and time management techniques for a daily work schedule. According to Wittenberg, 2012, there are many ways to save time for a home health aide. A. Use time management building blocks. 1. Identify your goals. 2. Review your time utilization. 3. Match time utilization patterns with your goals. 4. Prioritize for better time management. 5. Eliminate time bandits, procrastination, perfectionism, etc. B. Use computerized documentation. C. Plan and manage your schedule ahead of time, including your own self-care time. D. Do the whole job, or one thing at a time. E. Stay focused. F. Telephone management. G. Stress management. Sample home health aid questions. 1. Blank provides assistance to the chronically ill, the elderly, and family caregivers who need relief from the stress of caregiving. A. Home health aides. B. Pastors. C. Engineers. D. Surgeons. 2. Agencies pay home health aides from payments they receive from the following payers. A. Insurance companies. B. Health maintenance organizations. C. Medicare. D. All of the above. 3. The Center for Medicare and Medicaid Services payment system for home care is called the A. Home Health Prospective Payment System. B. Pay per charge. C. Service payment. D. Medical payment. 4. Clients who need home care are referred by a doctor to A. Hospital. B. Friend. C. Neighbor. D. Home health agency. 5. All home health aides are under supervision of one of the following skilled professionals. A. An engineer. B. A pastor. C. A registered nurse. D. Native medicine. 6. All of the following constitute the team of healthcare professionals except A. Home health aides. B. Nurses. C. Doctors. D. Engineers. 7. Blank helps clients to learn to compensate for disabilities. A. A client. B. An occupational therapist. C. Speech-language pathologist. D. Registered dietitian. 8. A legal term that means someone can be held responsible for harming someone else is referred to as A. Assets. B. Liability. C. Action. D. Discipline. 9. A particular method or way of doing something is called A. Orientation. B. A procedure. C. An activity. D. Information. 10. A professional relationship with a client includes A. Maintaining a negative attitude. B. Not finishing assignments. C. Doing only the tasks assigned. D. None of the above. 11. Professionalism means A. Having to do with work or a job. B. Your life outside your job. C. Disapproving client's opinion. D. Keeping late to work. 12. Blank teaches clients and their families about special diets to improve their health and help them manage their illness. A. A medical social worker. B. A registered dietitian. C. An occupational therapist. D. None of the above. 13. A professional relationship with an employer does not include one of the following. A. Always being on time. B. Completing assignments efficiently. C. Maintaining a negative attitude. D. Participating in education programs offered. 14. Which of the following depicts the meaning of laws? A. Laws are rules set by the government. B. Laws tell us what we must do. C. Laws help to ensure order and safety. D. All of the above. 15. Blank defines the things you are allowed to do and describes how to do them correctly. A. A plan. B. A liability. C. A procedure. D. A scope of practice. 16. Which of the following is not an example of legal and ethical behavior by HHAs? A. Protecting clients' privacy. B. Accepting gifts and tips. C. Being honest at all times. D. Documenting accurately and promptly. 17. Clients have the right to A. Have access, upon request, to all bills for service the client has received. B. Receive care of the highest quality. C. Refuse services without fear of reprisal. D. All of the above. 18. Unexplained injuries including burns, bruises, and bone injuries can be referred to as A. Mental abuse, B. Physical abuse, C. Psychological abuse, D. Passive neglect. 19. You can help protect your client's rights in which of the following ways? A. Respect your client's property. B. Talk or gossip about a client. C. Neglect clients in your planning. D. Enter a client's room without knocking and seeking permission. 20. To respect confidentiality means A. To tell the client's best friend about his friend's health condition. B. To keep private things secret. C. To discuss issues about a client within a family meeting. D. None of the above.